I had a young mother come into the office, and she brought in her 2-year-old daughter, and the daughter had just been out of the hospital for the 3rd time. The first time she had some inflammation in her right knee, and the doctor said, it was just a random infection. A couple months later, another hospitalization because of the right hip, and she just didn't want to move. And after going through all these different antibodies and looking at inflammatory markers in the body, the doctor said, it's just a random inflammatory process. And so by the time she brings Addie into me, she'd already been in the hospital 3 times. It had been inflammation in the right knee, the hip, the neck, and so we had to do the right testing. And that's the critical piece when you're trying to figure out what's going on, is get the right testing. We always say in the office, test, don't guess. And so we did some testing, and I checked her gut, strangely enough, and we found just a small bacteria that was in there, and you wouldn't believe the problems this thing could cause, but it created antibodies against her own synovial fluid. So there was no joint that was out of the realm of being attacked. And once we cleared that out, she's back to growing like she should have been. She's a happy 4-year-old running around like nothing's wrong. And the key is inflammation to anybody. You don't have to be 100 years old. You can be 2 years old and just have something in your body that's not supposed to be there.